"911, what's your emergency?"
You have to help us. He's bleeding. Oh my God, Sam.
"Miss, please calm down. Please state the nature of your emergency."
There's been a crash. They're hurt. You have to help them.
"We're dispatching units to your location. Please stay on the line until they arrive."
In a world where regrets are common,
I was ignorant to a lot of little things that nearly cost me my life.
I was scared with a lot of emotions running through me.
When I tell people I'm a survivor, they need to know what made it possible.
Welcome, welcome, welcome to the Dr. Vine Show, a podcast for people of all ages, highlighting and discussing health and well-being in grand style.
How will COVID-19 transform the world we live in? How COVID-19 dominated the year 2020 is still a mystery. One that scientists are still trying to understand its origin and how it spread. Such that even the best health systems around the world couldn't cope or handle the virus. It has exposed countries with poor healthcare systems when from the outside it seemed to be that they had a perfect health system. Shortage of essential medicines and supplies, underinvestment in public hospitals, lack of direction and coordination among policymakers, and political interference in health matters have all been laid bare for all to see. Leaders of countries with deteriorating health systems, who took every opportunity to travel abroad to countries with better health systems, had to make do with what was available in their country as a result of countries closing up their borders. What does this mean for health systems and the world we live in? See you in the intensive care unit.
DICU. Listen to the health topics discussed intensively, the very important topics dissected into details. Get informed, stay informed.
Here is one stat that will amaze you. COVID-19 is killing almost the same number of people every month than HIV, tuberculosis and malaria combined. Even with the development of vaccines, it's still very clear that infection rates are on the rise. Besides the health aspect, the global economy took a dive in the pool of recession. When global health and development leaders were asked the implication of COVID-19 to the world, over 20 of them gave their opinions. Who other person to talk more on this than the Nigerian former Minister of Finance and the chair of the board at Gavi, the Vaccine Alliance, Mrs. Ngozi Okonjo-Iweala. She pointed out how almost every country in the world had a lack of equipment and supplies to test for and protect against COVID-19, and how it was going to lead to countries to re-examine their supply chains for critical health products. She predicted this will lead to the need for countries to locally produce their medicines, medical supplies, and equipment, both developed and underdeveloped countries. There will be more investments in these aspects, in research, vaccine productions, and this will mean that trillions of dollars in economic losses, loss of life, and loss of livelihoods for millions of poor people all over the world will be prevented. But can this come true as predicted? A director at the McGill Global Health Program, Mr. Maduka Pai, sees the rich countries cutting off assistance to the poor countries after suffering heavy economic losses from COVID-19 infections. This will definitely shape global health. Imagine where the poorest of countries in Africa who depend on foreign aid to fight HIV malaria, tuberculosis are cut off. The snowball effect will be disastrous. Already, the United States under President Trump had cut off funding to the World Health Organization. China and South Korea used to be recipients of this foreign aid not too long ago, but are currently helping the World Health Organization, Italy, and other European countries to cope with the crisis. At the beginning of the global pandemic, China supplied ventilators and masks to countries across the globe, including to Europe. With countries closing their borders and movement restrictions being put in place, are we going to see a shortage of foods from the global food market, especially to the most affected countries and most vulnerable people? The scare of going to hospitals and seeing someone coughing or being at risk of cross-infection has meant technology has been more embraced during the pandemic than ever. Telemedicine has had a lot of registrations on medical apps, just as Google has had more symptom input on their search engine than before. And this may be the new form of consultations with a virtual meeting with a doctor online. Just as the hospital has moved to medical apps, offices have moved to houses, and meetings moved to Zoom. The meetings that usually required business class travels and lodging in expensive hotels are being done on home couches. Will the travel industry ever remain the same like before? It will take many years, if at all. Schools have been shut down. More than 1.5 billion children are affected by the closure of schools. Close to half of that number are in low and middle income countries. With how the Ebola outbreak panned out, many of these students won't go back to school again, impacting on their overall health. To further complicate things, on resumption of schools, there is the need for the schools to compensate for the periods of closure by increasing school fees, which the funds are not available for parents to pay. In the process of trying to put extra preventive measures in place in schools, parents have to spend more out of their pockets. This scenario will lead to early marriages, teen pregnancies, and child labor rates will rise. In a short while, there is a danger of reaping the progress made in the Sustainable Development Goals. In all of these, according to Catherine Connor, Vice President of Policy and Advocacy at the Elizabeth Glaser Pediatric AIDS Foundation, the pandemic will force a re-examination of global health architecture to promote an approach to sustainability that significantly increases investments in emergency preparedness with an eye to how that investment supports but does not supplant regular other service delivery. Global health will become a component of national security from now on. There's likely going to be a shift to the infectious disease that trouble high-income countries as the global standard, and let's focus on diseases prevalent in poor countries like polio. In the discharge summary, we shall look at 5 components of a successful response to COVID-19.
The discharge summary, your top 5 health prescriptions.
Welcome to the discharge summary. Some countries have excelled well in managing the COVID-19 pandemic. What can we learn from them? Countries like Singapore, South Korea, Hong Kong, Australia, and New Zealand. What did they do best? Number 1. Comprehensive monitoring. South Korea, for example, quickly established an aggressive monitoring regime that included drive-through diagnostic centers, contact tracing teams, testing, and quarantining international arrivals to the country. Number 2. Innovative use of digital technologies for tracking, for transparency of data. Hong Kong is using a geolocation data to create a publicly available dashboard that maps all current and former cases by buildings. Number 3. Population segmentation into key patient groups and risk categories. This distinguishes those who are infected from those who are not. Number 4 is a multidisciplinary cooperation with an all-hands-on-deck method. Team-based efforts proved most effective in these countries. Number 5 involved the integration of medical, social, behavioral interventions. An example is the systemic organization of food delivery to quarantined individuals. They obeyed the medical advice by isolating and quarantining from the social scene. But that hasn't affected their behavioral lifestyle, as they could still have their best meals in isolation. In Singapore, there was allocation of certain bus routes and specific seniors-only days each week in public parks, which meant even this most vulnerable group, the seniors and elderlies, could come outside and experience life in the park while still being kept safe. The basics, like growing healthcare workforce rapidly, increasing ICU capacity, providing more protective equipment, were already in place and maintained in these countries. Asian health systems had already experienced the SARS epidemic in 2003 and were well informed on handling these outbreaks. The fight against COVID-19 has been a new set of challenge to health systems across the globe. We should be able to properly handle these in future as a planet. Till next time.
You are listening to the Dr. Vine Show, the most educative show on the